As the nation marks 24 years since those deadly terrorist attacks on September 11th, 2001, advocates are calling on Congress to approve more funding for care for first responders and survivors. Nearly 3,000 people were killed that day. And now the number of people who have died from 9/11 related illnesses has surpassed the official death toll from the attack itself. According to a New York City Council member, 9/11 linked cancer deaths have surged 143% in just the past 5 years. The World Trade Center Health Program was established in 2011. This was under President Obama to improve survivors and first responders' access to health care treatment. Nearly 50,000 participants in that program have been diagnosed with 9/11 related cancers. John Beal joins us now. He is a first responder advocate and a former construction worker who was injured at Ground Zero during 9/11 cleanup efforts. John, thank you very much for being with us. Here we are 24 years later. What did you wake up thinking about this morning?
Yeah, I think today was a reflection on the day of remembrance. Your heart, if you have any humanity and empathy, your heart bleeds for those who lost a loved one. And your soul cries for those who are still sick and those who are dying from 9/11 related illnesses, mostly cancers. I've been to 213 funerals. I just got back from 2 days of being in D.C., and it's been nothing but events, somber events. It's been nothing but interviews, and it's been redundancy, talking about the struggles of the last 24 years at the 9/11 community, which is a finite number, which is getting smaller every day. These numbers are skewed. Everything we've ever predicted has come true, and science has now caught up to what we've been saying for the last 2 decades, that we knew we were getting sick and we knew we were going to die. And I've seen too many people get cancer and die. And, you're supposed to get old and die anyway, or get heart disease if you don't get hit by a bus. But these men and women, uniform and non-uniform, and those who lived and worked and went to school in Lower Manhattan, deserve better from Congress. And while we're a mandatory bill and Congress cannot stop us, they can delay it.
Well, John, you bring up these warnings that you've been giving for years and years. You warned just last year that money for this health program was running low. Now, given these cuts that we're seeing play out, what is that trickle-down effect to 9/11 responders? What is the message that they are getting from this?
Well, the message for me is that we're going to get a bill passed by the end of the year. I'm 19 for 19 and getting legislation passed. But if we don't get legislation passed, if you're in the program now, you'll continue to get treatment until 2090. God bless you if you live to 2090. But if you get sick, you're not getting into the program after 2027. And that will be a death sentence for a lot of people. Here's the thing that nobody talks about. We have a higher survival rate in the 9/11 community than the general population because our doctors and scientists have 2+ decades of experience in looking at these environmental diseases. And the fact that this administration, this Congress, this Secretary of Health are playing games with human life.
John, I also want to ask you about this. Your new book, it chronicles your discussions over the years with first responders who require federal help, as well as your journey with Jon Stewart to expand the 9/11 Victim Compensation Fund. Can you tell us, what was that process like?
I think it was an exorcism, John's a dear friend, but he takes a back seat in all of this to the men and women, uniform and non-uniform, that I brought to D.C., and that's what the book's about. It's about 12, 15 people that I've seen evolve from their times at Ground Zero through their illnesses, going to D.C. and advocating for the 142,000 people that are in the World Trade Center Health Program, for the 48,000 plus that have a certified cancer. This book tells their story. It's my way of saying thank you for making all those trips to D.C. with me. But in the book, at the end of each chapter, is a how-to guide to lobby and get legislation passed, whether it's at the state, federal, or local level, and not only to show them how to do it, but do it better than me. Because if I could do it, then anybody can do it.
John Beal, thank you very much for joining us on such a solemn day.
Thank you for having me.